my talk this time is on headaches. As I told you before that my special interest is in pain. I would like to cover as much areas of the body with different causes of pain, so that all of you know what you are suffering from or what common people do suffer from. Most of the time we go doctor shopping from one person to another, taking painkillers of one kind and the other kind, third kind. But I personally believe that painkiller has got very less role at all, if at all, in any pain. Painkiller is a $500 billion market all over the world. And still I am very happy with good old paracetamol. The best thing is to know what is the cause of any pain, and so is headache. The best part about a headache is that there is very little to actually give you pain in the head. Inside the head, inside the skull, except for one or two things, there is nothing much which gives you pain, except the muscles which are there on the skull. I'll show you one of my slides as we proceed along as to what are these muscles. Now, I will try to cover as many causes of headaches as we commonly suffer from. I am not well into things which are really very uncommon, which people like you and me should not go into. So, starting with my topic, headache. Now, this is because there was a lot of information this time and there are a lot of terms I had to write it down. Because one of my colleagues pointed me out that you are not given your age this time, so better show it that my reflexes are going down and I need some props to memorize. Anyway, so headache is one of the commonest symptoms in medicine, and this may include even a headache specialist. There is nobody at any point of time or any one day who may not have headache. And now this is actually a specialty as I mentioned. And the importance of knowing the causes of headache have been now realized by the medical fraternity. And with new modalities of diagnosis, headache is being looked at with a new perspective. But still in day-to-day practice, it is the most difficult symptom to diagnose. I have chosen this topic to discuss the common causes of headache and presentation and their treatments. The commonest headache that every one of us gets in today's life is stress headache, or we also call it stress migraine, or the other term is tension type headaches, TTH. This is because we all of us have got altered goals of our life. Today's life, the main goal is more materialistic, trying to earn better, having a good lifestyle, and this gives you headaches. This is more common in women. And the cause of this headache is nothing else but spasms of these muscles, as you can see on this slide. And there are few muscles on the skull by which we are able to move our brows and temples and things like that. It is like a tension. It is called tension headache. Why? Because the feeling is as if somebody has put an iron band on your head, and it is a continuous dull sort of headache. And these types of headaches usually respond to simple paracetamol or any other painkiller and a little sleep. And this is usually seen in the evening. It has been diagnosed that the cause of this headache is nothing else but hypoglycemia, that is low blood sugar. Everybody tends to get tired and fatigued as evening comes because of the whole days of work. So it has been strongly recommended to housewives and ladies that how to deal with their husbands. When their husbands come home from work, they are tired and they have got fatigue and they get headaches. So just standing on the door with a list of complaints, it's better to first welcome them in the house, feed them, rest them, and then combat them with whatever you have got. The second commonest headache that we have got postural headache. But before I forget, I would like to cover one more headache which is known as vertical headache. Vertical headache is we get this headache exactly in the middle of the head, in the center of the skull. This is a very common headache that I see in my day-to-day practice. And this headache is very less understood and diagnosed. And as I have taken very deep history, I have realized that the cause of this headache is that particular person. This headache is also known as sun headaches. That person tells that whenever I go in sun or in very harsh sunlight in the afternoon, I get this severe headache and then it does not go away for hours on end, even if I sleep. And taking history, I realized that these type of people have got very deep conflicts between two things or multiple aspects of their life in their subconscious. And it is this side, this conflicts in their head which is giving them headaches, and no painkillers work in this. All the time that I have to do is to reassure them that this will go over with time, and as you know, things unfold, life unfolds itself. The third commonest headache that we see in today's life is postural headaches. So common it is because all of us have come back to our chairs rather than working in the fields. So we are doing a lot of sedentary work, mostly on the computers. And this headache is because a particular nerve, that is the nerve which comes out between the second and the third vertebra from the neck, the C2 and C3, that gets pinched. And the branches of these nerves goes on the skull as well as the neck. So we get headache along with neck and shoulder pains. So we call it C2, C3 headaches. You will be able to read more about it on the net. And the second common cause is this posture. Children who are addicted to seeing TV lying down with their heads propped up, or people who are sitting all the time with their head down doing paperwork or work. And this headache presents in adults just like migraine, with throbbing, and they become sensitive to light, sound, feel nausea, and all these migraine types of headaches. But when we go deeply into the history, there is always a pinching of nerve, and when you press at that point is very tender. So we advise people to correct their posture by sitting in such a way to keep the chin close to the chest. That is the best treatment. Within 1 month, the headache goes away. As you all know, that whenever we talk of headache, the talk would be incomplete if I don't mention migraine. Migraine and cluster headaches. These are like brothers and sisters. Migraine is more common and in women, in ladies, and cluster headaches are more common in men. The presenting symptom of both these headaches are same. They are throbbing, the person is sensitive to light, to sound, he does not like any disturbance, he is irritated very quickly. And the pathophysiology, the cause, what causes these headaches, both migraine as well as cluster headache, is this, that there is a lot of metabolic end products. As the body works, the brain also works. And this working of the brain generates certain chemicals in the brain, like in medical terms we call it histamine, 5-hydroxytryptamine, bradykinin, and substance P. There are so many other substances which are released in the brain. And in these migraine people, they have got a little less functioning system to clear out these substances from the brain. So that is why when these substances gather too much, they get these migraine attacks. I will talk about this migraine in a little detail at the end of my talk. A little more about it before we go further is this: migraine has got trigger factors. Most of the people who realize, suppose by eat red colored food, like tomatoes, carrots, then they get, or they don't sleep, or they overwork, then they get it. Migraine, you get two types. One is with aura, without aura. Some people can feel that, okay, now I'll be getting that headache. And some people get it like a sudden thing, a bolt out of the blue. I told you about the pathophysiology, the lifestyle changes, hormonal changes. Women do get these headaches during their menses, etc. Now, the other is in ladies, we get a type of headache which is more common in European countries and it's less common in our countries because we call it chronic paroxysmal headaches. These chronic paroxysmal headaches, ladies, they get headache all over the day, but they get it at intervals of about 15-20 minutes. Suddenly they get their headaches, but they are paralyzed, and again they are better. So these attacks comes once a month or once every 2 months, and they do not know what to do. The best drug which has been known for it is indomethacin. Then a common headache which is corresponding to this chronic paroxysmal headache in India is, you see common people saying, pitka dard. Pitka dard means they get these headaches like migraine, and they say that when I get a a bilious or a bitter or a sour vomiting, then I feel better. So that is more common in India. Another headache which is not so very common in elderly people is temporal arthritis. You will see in many people, who are walking on the road, that one artery over here on the temple is very thick and prominent, and you can actually see it throbbing. Now, genetically, if a person is prone to get arthritis, that means inflammation of this arthritis, we call it collagen vascular disease. It's a different set of diseases, or a rheumatic. It's a rheumatic disease. Suddenly, these arteries goes in spasms, and there is a very high chance of that person becoming blind or even fatal. And if it is diagnosed on time, the treatment is given large doses of steroids, very large doses, and you can save that person. Otherwise, it is a very difficult headache to diagnose unless a physician is all the time conscious about it. There are many other common headaches, like headaches which we get because of infections inside the brain and outside. Inside the brain, we commonly see meningitis, then encephalomyelitis, or even brain tumors. Brain tumors, one of the presenting symptoms is headache, or epilepsy, or forgetfulness. Other fevers which may present with headache, only headache is dengue. We are all now very familiar with dengue because we have suffered so many times. Malaria, viral fever, typhoid, and sinusitis. But sinusitis with headache, a person usually has a nasal discharge or block, and he has got little fever. Other is ophthalmic headache. You see so many people we get. They say that I was getting headaches for years. Then I went to an eye surgeon. He said that you have got certain numbers, and I have put glasses, and still I am not better with it. Ophthalmic headache or this eye-induced headache, you must always remember that headache comes by using the eye, and when you use the eye for a focus work, like reading or seeing a movie, but that headache is induced after exactly about half an hour to 1 hour. Then you know it is eye-induced headache. And the commonest cause of eye-induced headache is astigmatism. When there is astigmatism is a refractive error. So you get this headache when there is a difference in the focal length, both the vertical as well as the horizontal axis of your cornea. So that is the cause of the headache in eye. Post-alcohol headache